Good evening, everyone. Thank you for joining us for tonight's final webinar in our series. And my name is Michelle Richards, and I'm here on behalf of Scleroderma Atlantic, and I will be moderating tonight's webinar. Long-term strategies and sustainable habits, getting down to the crux of the series. And we'll start with our disclaimer, Scleroderma Atlantic's disclaimer. Scleroderma Atlantic in no way endorses any drugs or treatments shared within this webinar. It is recommended that all drugs or treatments be discussed with your physician for proper evaluation and treatment. We will take questions at the end of our webinar, and you can find this on your computer at the bottom icon, and there's a Q&A there. And if you're using your tablet or your iPad, you can click to the top of your screen, and that's where you can send your questions. So, like I said, over the past, I think this is the 6th session, Vanessa. We've had 5 sessions, and we've explored various aspects of naturopathic medicine and health-related topics for scleroderma. And so in this final session, we will bring everything together, holistically integrating the key concepts and evidence-based takeaways to deepen our understanding of health and well-being. This discussion will focus on practical applications or empowering the participants with knowledge to make informed decisions about their health. As always, this session is for educational purposes only and does not constitute for medical advice. If anyone's joining us for the first time, I'm pleased to introduce Vanessa Cook once again. Vanessa is a naturopathic medical student, and she just kind of finished her theory part, I guess, of the program, and is going into the clinical and seeing patients, which is fantastic. Is a student based in Toronto and completed her psychology degree at Western University. Her personal journey as a scleroderma patient is the driving force behind her passion for holistic healthcare. Along with her role as the chair of patient support on the board of directors for Scleroderma Canada. Vanessa also works in research with the Scleroderma Patient-Centered Intervention Network, known as SPIN to many of us, focusing on projects aimed at enhancing the lives of scleroderma patients. She is dedicated to continuing patient-centered work, particularly in autoimmunity and women's health. Vanessa's holistic approach to healthcare reflects her commitment to making a lasting impact on individuals dealing with scleroderma by integrating personal experience, academic knowledge, and research expertise. And so I will then now pass this over to you, Vanessa, to wrap us up for our series.
Awesome. Thank you, Michelle. Also, I have to apologize in advance. I was just saying I'm still currently at work right now, so that explains my background looking a little bit industrial. I may have some people coming and going behind me, but nonetheless, just to give a little disclaimer so no one gets too distracted with me. I'll go ahead and share my screen. And then maybe Michelle, could you give me a thumbs up if you can see this okay? I'll see that. I can go into presentation mode too. Okay, that's all good. Beautiful. Today's session might be a little bit shorter. We're going over a lot of the high level kind of key takeaways that we went through throughout this series. So, you know, I was going to say if there was one to join, I feel like this is probably the best, most tangible ones that we can kind of get into looking at different integrated approaches to managing scleroderma from a naturopathic perspective. So like I mentioned, today we'll be kind of going over those long-term strategies and tangible takeaways that we looked at through the course. I think we started this in December or January. So for the past like 6 sessions, what we've gone through. And then just some disclosures Michelle had mentioned too, but I'm affiliated with the Lady Davis Institute of Medical Research. I do research as a research assistant for SPIN. I'm on the board for Scleroderma Canada. I currently attend school at the Canadian College of Naturopathic Medicine. And then this is obviously brought to you by Scleroderma Atlantic. And then a disclaimer too, that this is not medical advice, very much intended for self-educational purposes. And the information shared is not a substitute for professional medical guidance, diagnosis, or treatment. Always consult your healthcare provider if you have any questions, or if you're interested in supplementing, changing your diet, any of those things, making sure you're reaching out to either your naturopathic doctor or your primary care physician. And then hello again. So I guess as an update, as Michelle mentioned, I'm currently in my final and clinical year of school, which means we are finally seeing patients and kind of doing the things that a naturopathic doctor would be doing in clinic. So that's been very exciting for me, and it's kind of nice starting the series and then now wrapping up where I'm actually seeing patients. So it's been a really fun time. I always explain that I've been diagnosed with scleroderma and living with it since my second year of university. So that was around like 2018, 2019. Right before COVID had hit. And since then, that kind of propelled me to want to go on the path to become a naturopathic doctor. I felt really inspired, by meeting a lot of patients, and a lot of people had the same idea as me as to what can I do to kind of, feel that I have control over my disease, and is there anything at all? And I kept running into the answer of no and yes and maybe. And so it was something that kind of really propelled me to want to give back tools to the community, because it's something that I dealt with myself personally. To go over our webinar breakdown and the things that we will be kind of wrapping up and going over very high level today. So to start us off, we went into a quick introduction of naturopathic medicine, which we will do today. February, we talked about diet, gut health in March, managing pain and fatigue, and then understanding hormonal health. And then same thing that we were discussing is going over those long-term strategies, the sustainable habits, and kind of like that, big bulk of, if I was to give anything to take away from any of these topics, that's what we are going to be going through today. So just to start us off with naturopathic medicine. So naturopathic doctors are trained to diagnose, treat conditions through natural and traditional therapies, biomedical perspectives and pharmacology, root cause perspectives of symptoms, diet and lifestyle, and physical modalities. This includes acupuncture, cupping. We do physical therapy, sometimes exercise with patients, depending on the patient too. I always say that living with scleroderma affects many aspects of your health and well-being. Therefore, optimal treatment should have an integrative approach. Oftentimes with conventional care, it's 100% necessary in managing the disease. However, we know that we are individuals, and there's kind of a biological component to who we are. There's a social component to who we are, and a psychological component too. So how can we kind of weave ourselves in between all of these different components? And if conventional care covers, one aspect of our symptoms, how do we kind of have this more holistic picture of treating the whole individual, and looking at it from a more like root cause perspective, in that, we're treating Vanessa as a person living with scleroderma, who is also a fitness instructor, a student, a stressed out student as well, someone who prioritizes their diet, their lifestyle, who doesn't sleep very well, but all of these things, how can we address that, rather than just kind of looking at, one individual has Raynaud's, what's the cure for Raynaud's, and how can we kind of tie all of that together? Naturopathic interventions, as I mentioned, we focus a lot on diet and nutrition. So this can be kind of from, again, that root cause perspective. We're looking at what an individual's diet is looking like and how we can kind of supplement and maybe provide some counseling in terms of what the individual needs. A lot of times we have obviously our baseline recommendations, but they can vary very much person to person. We're going to go over some of nutritional interventions too for people living with scleroderma. But how do you personally show up, and what do you need? Is one person iron deficient? Is one person not? And how can we supplement and provide counseling based on the individual, rather than just on, based on what every person might need who's living with the disease. And then also supplements and botanical medicines. We often do supplement and medication reviews. So looking at different interactions, making sure people are taking these at optimal times in the day as well too. And even just being consistent with supplements and medications. I know one of the hardest parts in our job is getting people to actually take something consistently. So if we can get someone on a good habit and actually using the things that we are prescribing, that's half the battle usually. Lifestyle approaches, this is often looking at weight loss, again, that diet and nutrition, sleep habits. I always say the kind of like three pillars of naturopathic medicine, or even just in general, three pillars of almost life are diet, sleep habits, and then also exercise. So kind of looking at how we can approach that from a lifestyle perspective. And again, very individualized to the person. We do get trained in pharmacology. It depends on where we are located and where you are licensed. So I always say there's a difference between a licensed naturopathic doctor and just a naturopath. In Ontario, thankfully, the title of naturopathic doctor and naturopath are both protected titles. But if you were to go to the States or somewhere where it's not licensed, someone could just be a naturopath. And that could be someone who has never done a course in their life on any of these things. It could just be someone, who's kind of scamming, for a lack of better terms. So always looking into, at least in Ontario, if it's a naturopathic doctor or naturopath, they for sure have been trained. And nonetheless, depending on where you are located. So in BC, we do have prescribing rights, whereas in Ontario, we don't have prescribing rights. We have some depending on what you're looking at, but in BC and other states, we do have extra prescribing rights. Nonetheless, we do get trained in everything in the hopes that if our scope was to open up one day, we would still be able to use this. And then Eastern perspectives, looking at traditional Chinese medicine. So we learn a lot about herbs, acupuncture, lots about acupuncture. I feel like that's one thing that a lot of people don't know is with naturopaths, we do a lot of acupuncture and a lot of Eastern diagnosing as well. And then health psychology and physical medicine. I'm quite lucky. One of my interests is building muscle mass for people with chronic disease and also just women who are postmenopausal. So I'm really into sports medicine and how we can use physical medicine to help people retain and build muscle mass. So that's kind of where my specialty is. But due to that, I'm on the sports medicine shift, and that's been something I've been quite lucky to have an experience with and learn from. And then just going into, again, very high level, what we had talked about in the very first webinar that we had done is how naturopathic medicine and conventional care kind of intersect. So I often talk about how medication side effects and health optimization kind of come together as one. So if we're looking at medication side effects or using medications to treat our scleroderma, again, can be 100% necessary and very optimal if we want to help ourselves in living with the disease, but also how can we make the body a bit more tolerant and resilient? So when we are going through those flares or needing to use medication, how can we, feel okay and still be able to take the medication? So oftentimes, one of the side effects with medication is nausea. We often look at using ginger, herbal teas, or tinctures. Ginger can be found in pill form, or you can take it as a tea. Quite inexpensive, very easy integration that we can add in, and we can prescribe for people if they are feeling nauseous. And then bone loss, osteoporosis, that sometimes comes with different medications as well. We always do vitamin D, calcium. Also magnesium is a good one to throw in there too, but also resistance training. So when we talk about resistance training, we're using something with weights and then also potentially with a band, creating resistance there. For fatigue, we often use adaptogens as well as diet to modify different fatigue. Again, we'll be going over a couple of high-level fatigue interventions as well. Skin irritation, we talk about bombs, hydration, omega-3s, things that will kind of help to add fat almost into diet and give us a little bit more elasticity to the skin, because we know that scleroderma has that very constricting, drying effect on the skin too. For immune suppression, talking about stress reduction, antioxidant support, and then herbs for immunity, muscle balance and muscle weakness and cramps. We want to look into electrolyte balance, magnesium, and then also hydration status, and then GI concerns, which we'll also talk a little bit about further. We look into diet and probiotics. In terms of dietary interventions for scleroderma, there's obviously a super big risk of malnutrition and absorption issues. So this is something that I think majority of people that I work with scleroderma are quite aware of, that we know that we have absorption issues, whether it's in the form of we bloat a lot, there's diarrhea, constipation, and knowing that we're not kind of ingesting that nutrients. A lot of times when we get our blood work done with scleroderma, we see vitamin D deficiencies, we see iron issues, Even after trying to correct it, sometimes it can be very tricky in people living with scleroderma because the absorption issues go quite aggressively. Not for everyone, but it definitely can be a concern. So what we can do is nutrient injections. At my clinic, we do B12 injections, but there's always vitamin D injections. There are such things as iron transfusions. It's usually the last step if someone is very iron deficient that we want to do an iron transfusion, but that is always an option. If someone is consistently at very low iron levels and not absorbing things from their foods, then you can actually get transfusion for it. I always recommend for people living with scleroderma that we want to be using cooked and easy to digest foods. So vegetables that are cooked, broth, stews, smoothies. One really great way to get a bit more nutrients into our diet is cooking things in bone broth. So if we want a bit more protein, obviously just being a bit mindful of the salt content of your bone broth if you do choose to use it. But cooking vegetables, cooking rice, even pasta in bone broth can be a really fantastic way to get a little bit more nutrients into the diet. And then obviously for smoothies, there's that risk of Raynaud's as well too, but just making sure, that the food is actually, it's a bit more broken down, so it's easier for us to process. In people living with scleroderma, we have very common sensitivities being nightshades. So those are our eggplants, our peppers, our tomatoes. Not in everyone. I find I can tolerate nightshades kind of okay. And I don't always see this with every single scleroderma patient, but it is just something to be aware of. Processed and fried foods are always difficult for no matter who the person to break down in the body. Anything difficult to chew or digest. So thinking of fibrous meat, sometimes steak can be really difficult. We have that risk of choking as well too if we have esophageal tightening, high fat food. Some people have sensitivities to dairy, and then raw cruciferous vegetables. So that would be like your cauliflower, your broccoli, and then also artificial sweeteners. This is one that I feel people aren't as aware of. Can often cause a lot of gas and bloating in the stomach after we ingest artificial sweeteners. So just being careful if we're having any pop or anything like that. That's also to add to our common sensitivities is anything with carbonation can generally be quite irritating to people living with scleroderma just because it causes that bloating. And we have that esophageal tightness as well. In terms of recommendations, we always recommend eating small, frequent meals throughout the day rather than having 3 big meals. Maybe you're having 4 to 6. I know myself, I generally have around 4 to 6 a day too. And maybe they're more snacky like meals or having a lunch that's almost like spread out a couple times throughout the day rather than just having those big 3 meals. Chewing food thoroughly, eating slowly as we can, avoiding lying down for 1 to 2 hours. So sitting upright, or even better, going for a walk after our meals too. When we go for a walk, there's a lot of evidence that this helps to reduce our glucose and insulin spike. So it kind of keeps our blood sugar a little bit more in check, which can be a really good tool if you experience fatigue, especially after meals. Go for a quick walk. It doesn't have to be super long. Go for a 10-minute walk. After anything counts, as opposed to doing nothing. So walking after meals, sitting upright when eating for 30 to 60 minutes after. Again, we can do that with a walk. Limiting our raw vegetables, high fat meals, spicy foods if we experience GERD and bloating. And then considering, like I said, the easy to digest foods, so pureed soft foods, if swallowing is something that's a difficulty depending on your individual needs. And then drinking fluids between meals, not during, to avoid acid reflux. So we want to be having sips of water throughout the day, definitely trying to get our water intake. Depends on the person. A lot of times I see patients saying that they want, like 1 liter a day, 2 liters a day, 3 liters a day. And it really just depends. Generally, a rule of thumb is that we want our urine to be hay colored. So kind of like straw, like colored. So very light yellow or clear. Doesn't have to be 100% clear, but getting to kind of that hay hue, if that makes sense. And that's when we know we're at a relatively decent hydration status. Also, you can get hydration status checked on blood work too if we check our electrolytes. In terms of other dietary interventions, catabolism and anabolism is a really big topic that I always talk about. I could talk about it for probably as long as this entire meeting or webinar. But to make things short, when we're in a catabolic state, that's when our muscle is essentially leaching amino acids from our tissue. When we're in an anabolic state is when we're kind of building things. So catabolism, we're breaking things down. Anabolism, we're building things up. In a catabolic state, we often see that patients living with scleroderma end up in this state because we're going through a flare, because the body is demanding a lot more of us, because we have this autoimmune process going on. So when we're in that catabolic state is when we actually want to utilize protein. I know a lot of times we think of when we're sick, we want like chicken noodle soup and easy to digest foods, and that's 100% true. But we also want to be using protein because we have this negative nitrogen balance going on. So we want more protein to bring us kind of outside of that catabolic state where our body isn't leaching amino acids from our tissue. It's actually just at kind of almost like a neutral level rather than leaching. We're at neutral. We're not building. We're not taking away. We're just at neutral if we're using a lot more protein. Generally, the protein recommendations, they kind of fluctuated, I want to say, within the last couple of years. I've seen as low as like 0.2 to 0.5 per pound or per kilogram. In general, what I usually see in practice is we are recommending about 1 gram per pound. I know that conversion doesn't 100% make sense to every person, but if we're just to, make this super easy for math's sakes, because I'm not fabulous at math. If we were to do 1 gram per a person who weighs 100 pounds, we'd be doing 100 grams of protein per 100 pounds. Sorry, you can come on in. Per 100, per 100 grams of protein per 100 pounds. If the person weighed about 100 pounds, give or take, it's definitely a lot of protein that we are integrating into the diet. And then overall, we want to just be maximizing whole foods, avoiding fried and heavily processed foods, learning individual sensitivities. A tool that I often send patients home with is a diet diary and symptom log. So supplementing to repair gut health, gut dysbiosis. We often use glutamine, probiotics, and stomach acid producers, depending on the individual. And then another tip that I usually recommend is a protein source with every single meal, adding vegetables and fiber where necessary. Another good tip for people living with scleroderma is a protein powder. Usually I recommend something like a brief protein isolate. This sounds really disgusting to kind of explain it, but we're looking at when we take like a whole steak and micronizing it. It's one of the best and easiest ways that we are absorbing that protein powder. A lot of people have issues with whey, it causes bloating, and sometimes people just don't process it well, especially if they have a dairy sensitivity. So usually something as a beef protein isolate. I know Designs for Health has a really good one, not sponsored or anything like that, but can be one that we add into the diet and is relatively well tolerated among people living with scleroderma. They're looking for a different protein powder. Also, I guess to go back to this too, I've been asked a lot about collagen in the past. The only thing with collagen is that we have good evidence for skin hydration. Obviously, for people living with scleroderma, there's an excess of collagen in the body. We don't have particularly a ton of research of collagen supplementation for people living with scleroderma, if any at all. So I would just caution using it. I use it occasionally if I know I want a little bit of extra protein in the diet that day, or if my skin is necessarily feeling dry. But I always say use it at your own risk. It's not something that I'm always jumping that every person needs to be supplemented with collagen or against or anything like that. But if it is something that we want to be using in the diet, just using it with a little bit of caution given the disease and its mechanisms. To go on to a bit of gut health, I believe this was our second topic. Very high level things, dietary factors are fillers, stabilizers, and additives in processed food. So these can influence our gut microbiota. Antibiotics obviously wipe the gut microbiota, can be incredibly necessary when we're treating acute illnesses. However, we also just want to be careful because it gets rid of our good gut bacteria too. So when treating acute illnesses, we also want to see how we can kind of replenish those good gut bacteria in the diet. Medications can also have an influence on our gut microbiota. Genetics, medical conditions, stress, birth, delivery, C-section versus vaginal birth. So when we have a C-section, we know that we are getting less of that kind of our mother's microbiota passed along to us through that vaginal birth. And then exposure within the first 3 months of life. We kind of talk about when we had like helicopter parents versus not helicopter parents, and people will say like, oh, it's good for children to eat dirt and play and do all of these things, which it definitely is, because that's when their immune system is first developing, is within that first 3 months. It's very beneficial. For gut healthy ingredients, we talk a lot about fermentable fibers, oats, flax seeds, chia seeds, nuts, and multiple seeds. These also help to slow down digestion too. For people with scleroderma, because there can be that issue in processing and breaking things down, I often recommend blending them. So if we're blending our flax or our chia seeds and then adding it into our smoothies or oats, anything like that, using fermentable dairy, kefir or yogurt, anything that's fermented is going to be gut healthy within reason. And then also resistant starches. One tip that I always love is when we cook pasta, if we actually let it sit overnight, and not to say pasta is necessarily good for you, but if we cook pasta and then let it sit overnight, it actually becomes a resistant starch, which is harder for the body to break down, which is a good thing. So we want our body to have to actually be kind of pulling at our food to be breaking it down. So if we leave our starches overnight, that's one way that we can have a resistant starch. You can always supplement with this as well too. Fermented vegetables, looking at sauerkraut, kimchi, miso, and tempeh are also fermented. Sometimes we'll do supplementation with something called glutamine, but it's also naturally found in bone broth. And to explain it, I guess, in lay terms too, glutamine essentially works when our junctions in our stomach or in our digestive tract kind of become leaky. So if they're normally like this, they kind of become like this. Glutamine helps to bind everything together and kind of line that digestive tract too. So we look at glutamine as a very healing thing for the gut. Again, is it something that I think every single person should supplement with? Definitely not. Same with probiotics too. We always want to get probiotics from the diet first. And then if we see dysbiosis, that's when we might prescribe a probiotic. I do always caution probiotics in people living with scleroderma because it's not something we want to prescribe lightly. It is something that we want to be careful with because we know that there's a big tie between the gut and the immune system. If we stimulate the gut too much, we might have stimulation in the immune system, which is not a good thing in terms of scleroderma because the immune system is already upregulated. So if we can modulate this, and then just being careful, making sure if you are taking a probiotic, you're either doing it under the supervision of a naturopathic doctor or your medical doctor just to be safe. And then we also have digestive bitters to stimulate digestion. This is something like a gentian, often comes in tincture form. Apple cider vinegar before meals as well, diluted in water is one way that we use this to produce stomach acid. Again, not necessary in every single person. Sometimes people have too low or too high of stomach acid as well. So like I said, just doing that under the supervision of your doctor. And then going into pain. So this was, I think our third or fourth was pain and fatigue. Again, this is going to be super, super high level. We talked a lot about different processes and the pathophysiology around pain. So just going over very high level. In terms of general strategies for pain management, we often use ointments, creams, and topicals for people living with scleroderma. But then different botanicals and supplements for pain management specific are boswellia, devil's claw, which is often used for arthritis and osteoarthritis. Same with eggshell membrane, glucosamine, same thing. Often with anything joint related, we'll see a combination of glucosamine and then also the devil's claw. Curcumin is a massive anti-inflammatory. This is actually just the active ingredient in turmeric. So it's kind of that active ingredient derived into something supplement form. And it's, very common for a lot of people with systemic inflammation will be using curcumin in the body. We already talked about ginger as well too, in terms of nausea, but it can be used for pain management, particularly for menstrual pain, is where we see ginger prescribed. Arnica, also similar to curcumin, is just a big anti-inflammatory. We generally use it topically as a roll-on for sore muscles, sore joints. You can buy it at the drugstore, very easy to get. And then also omega-3s because we want kind of that fatty component of the omegas to help with, systemic inflammation, but also with blood flow as well too. Thankfully, as we were talking to with sports medicine, we have MSK related pain therapy. So doing physical therapy, prescribing different exercises, stretches, etc., acupuncture. physio workouts and exercises, sauna, stretching, and then also hydrotherapy. I do always caution for people with scleroderma, since there is the risk of Raynaud's. We never want to be going from a super cold environment to a super hot environment. Generally, if we are doing hydrotherapy, it's from warm to hot or warm to warmer. So we get that kind of vacuum effect that occurs in the vessels and releasing toxins, etc. But we don't want to be doing anything that is drastic or something that's going to worsen anyone's condition here. In terms of strategies for fatigue, this is definitely a lot and a big list, but regular low intensity exercise is one of the most evidence-based treatments for fatigue. When we talk about pacing, this is essentially kind of marking down your day. So if we had a list of 5 things that we are going to do in that day, how can we kind of pace between those 5 things? And just making it easier for ourselves. So oftentimes chronic fatigue or post-exertional syndrome is seen in people living with scleroderma. If we can pace ourselves throughout the day and leave the things where they're going to tire us more throughout later towards the day, then that's a good way that we can pace and strategize our day. Oftentimes, we'll have a big list of all the things we can get done. And we'll say to patients, can we pick 5 of the most important things? We'll schedule a couple of things, give ourselves some rest in between. So it's a lot of scheduling, but it definitely makes a lot of difference. So, having an activity and then a bit of rest, having 2 activities and then a lot of rest, and then having the most exertional activity, maybe that is going on a run or doing some exercise towards the end of the night, because then we can sleep after. So just pacing ourselves throughout the day. That's kind of the general idea of pacing. Activity management, prioritization goes into pacing as well. For nutrition, we want nutrient-rich, well-balanced, and whole foods, supplementation if necessary. Oftentimes we'll look at potential creatine supplementation for fatigue. Not something that I recommend for people, especially with kidney dysfunction, nothing that we want to be going near. But if it is something and someone is a candidate for that supplement, then it might be something that we look into. Progressive muscle relaxation is where we kind of tense up, one area of the muscles when we're in bed or lying down or resting, and then go to full relaxation. So we'll go full tense for 10 seconds, count down from 10, 9, 8, 7, 6, and then at the end, giving full relaxation. We'll do a full body scan of that too. Mindfulness and meditation, and then cognitive behavioral therapy. In terms of different strategies for fatigue, but also sleep hygiene, we always want a consistent bedtime and wake time. I always say to my patients, over anything when it comes to sleep, consistency is key. Our body gets so used to things, it affects kind of that binaural sleep and wake cycle that we get throughout our day, and our production of melatonin, the hormones that start to wake us up eventually too. So consistency really is key when it comes to actually like fixing your sleep and practicing good sleep hygiene. Avoiding napping in the late afternoon if possible. Obviously, this happens with people living with scleroderma. Napping is sometimes, the one way they get through their entire day. Totally fair. But if we can avoid it in the later afternoon, that will obviously help us get to bed sooner too. Having a good bedtime routine, so showering, putting the phone away. We want to limit caffeine, putting the phone away at least 1 hour prior, and then avoiding eating before bed too. And then also having a cool environment. Again, for people living with scleroderma, I don't want anyone making their house extremely cold, but colder than normal. And then making sure that we can get nice and warm, just so it's, simulating that cool environment, but we're not actually cold ourselves. We're still warm in our bed, nice and cozy. It's almost like a bear in a cave. We want that cave to be nice and cold, but we're actually very warm and cozy. And that helps promote good sleep hygiene. To go very briefly over hormones, because hormones are a really big topic and very complex, and generally take blood work for us to tease things out, but very beneficial, and I feel like hormones kind of rule the body in a way. We're looking at growth, metabolism, reproduction, mood, maintaining homeostasis in the body, and then temperature regulation. So hormones are essential chemical messengers in the human body that regulate and coordinate a very wide range of physiological processes. In terms of hormonal milestones and concerns, There is some overlap, and I talked about it in our previous webinar for hormones. But when we see kind of estrogen dominance in different diseases, so we obviously know that scleroderma is, mostly affects women. There's still some men that are affected too, but mostly women. We do know that there's some form of hormonal component there. When we talk about hormonal concerns, we're looking at cycle irregularity. Pregnancy obviously causes massive hormonal shifts in the body, and that can, change the way that you respond to treatments and change the medications that you're onto. So double checking with your family physician if you're on any medications and trying to get pregnant or currently pregnant. With menopause, we have a decrease in estrogen, which leads us to a risk of osteoporosis. So if you're currently premenopausal or menopausal or postmenopausal, we always say checking in with your vitamin D status, maybe getting a DEXA scan to see how strong our bones are and if supplementing is something that is necessary. Usually for women who are postmenopausal, we always want to be supplementing with calcium, a vitamin D, maybe a magnesium as well. There's a rare case where it's not too much of a risk, but we want to try and combat the risk of osteoporosis regardless. Raynaud's can also sometimes worsen, not in every person. There's the risk of dry skin, mood swings, joint pain, and then fatigue as well too. Symptoms of hormonal imbalances, because like I said, they sometimes overlap with scleroderma, sometimes they don't. Mental health symptoms, digestive issues, menstrual irregularities, weight changes, skin and hair changes. When we look at different disorders, we're looking at metabolic concerns where there's insulin resistance, so that stubborn weight loss, inability to lose weight. PCOS, which is polycystic ovarian syndrome, very common in people in general and something that is very treatable. Endometriosis, acne, and then kind of that estrogen dominance piece that we were talking about earlier too. Oh, that's totally done. Okay. Yeah, so that's kind of very high level, going over everything that we talked about throughout the last 6 months, I want to say last 6 sessions. Thank you so much for listening. If you ever have any questions, you can always email me. I'm now taking patients too. So I always throw that out there that I love working with people with scleroderma. I'll stop sharing my screen so that we can come back to the group.
All right.
Start my video. Okay. I can see it.
Perfect. Thanks, Vanessa. That's we did a lot. We covered a lot. We did a lot.
Lots. I know. I was like,
lots.
Yeah. Sorry, guys. That was a lot in this session. But if you have any question, I'm always here to answer.
Yes, and I should say too, just to a reminder, our videos are posted on our YouTube channel as well, so people can go back and revisit all of the webinars. As well too, Vanessa, I know there are a couple of questions in the chat, but I know too. My question is like taking everything that we've learned, and if we're trying to come up with the long-term strategies and how to form habits and good behaviors moving forward, like taking all this information, where do we start? Because it can be overwhelming.
It's a lot,
So I'm wondering, in terms of someone that's like, okay, well, where can I start with this, and this? What are some strategies or habits that we can take that, like from your experience, of how to implement some of this great information?
100%. Yeah. So I always say, starting small and then going big. Oftentimes when we want to make a change, we're like, oh, I'm going to start taking supplements. So I start taking 100. And even though that's, exciting to us and it makes our brain kind of happy because it's the big change that we want to make, we know it won't necessarily be as sustainable versus if we say, oh, I have these 3 supplements I want to start taking, or maybe 5 supplements I want to start taking. And if it's not under the help of like a naturopathic doctor or a physician, or they're not necessarily, things we want to be taking right away, then maybe there's a way that we can integrate one supplement one week and then stack with the next week, and doing things that will kind of help us slow things down and then add things in and see if there are any issues. I always say consistency too with supplements, because it's very difficult for us to take it. We always say, there's obviously optimal times in the day to take different supplements, but even if we can just get you taking it, and then we can kind of adjust further down the line. So for iron supplementation, we always know it's better to take that on an empty stomach. But does that happen? And do people remember to take it? And then do they forget to take it if they're not on an empty stomach? 100%. And would I rather someone take an iron supplement, even if they're not on an empty stomach, versus them missing a couple of days? 100%. So just adding in the small things and then kind of compounding too. Calendars are always very helpful as well to get people to remember. And then also those little like pill things are always super, super beneficial, because then you have a visual reminder. Yeah, I feel like the biggest thing is just reminders, whether we can do that depending on how your learning style is. If we need kind of that auditory reminder, so we have an alarm going off, or if we have that visual reminder of, oh, I took my supplements today. I know I'm a very visual person, so when I see like, oh, I didn't take my supplements, I'll take them at night, then that's a good reminder to me that I haven't taken something throughout the day. I hope that answers the question. Okay.
Yeah. I think, yes, absolutely. I think there's all kinds of tips and tricks so that we can share within the community that we've all kind of already maybe implemented on trying to adapt exercise and these, try to have a holistic approach to our healthcare. So we involve our medical healthcare professionals and as well as our going to a naturopath and osteopath and involving various disciplines. So I think as a community as a whole, it's been my experience that we all come with wealths of things that we've learned along the way. And I think the greatest amount of support in trying to change any behavior is to do that collectively.
Yeah, totally.
Some way that we could say, hey, let's continue. As we talked previous, how can we continue after the webinar series? Is there a way that we can continue conversation with you on certain topics, even if it's a half-hour chat every month or something? So anyway, I know there were a few questions and I can talk. So I would like to, let's have a look. Let's have a look here. Can you see the questions as well?
Yes, yeah. I see Dina had two.
Okay. So if you want to, I'm to be reading them out, but if you see the questions there, I can read it out. But Dina has said, I've been diagnosed with scleroderma, and I would like to know if intermittent fasting, alternating with longer periods of fasting, has shown to be helpful. This takes also a minimum amounts of vitamin D of 10 or 10,000. Would that be 10,000 international units? Mm-hmm.
Probably. Yeah. So for intermittent fasting, there's been a lot of kind of mixed evidence. At first, we thought intermittent fasting, even just in general, not in scleroderma, was super, super beneficial and everyone should do it. And it's, fantastic. And then I think we kind of retracted the statement on that, especially for women, as we are seeing for hormone production, as things are just not flowing super well. And we're kind of slipping into putting our body into a more stressed out state prematurely. So we're having a lot of cortisol fluctuations. It's not actually as Hail Mary as we kind of thought it was. Not to say it's not beneficial for everyone, especially if people already have metabolic concerns. It still can be beneficial. In terms of the evidence in scleroderma intermittent fasting, what we have the most evidence for is something called a Mediterranean diet. So I talked about that in the nutrition one too, but that's mostly whole foods. We're also eating a lot of anti-inflammatory foods. So a lot of fish, lean meats, occasionally red meat, lots of veggies, lots of things that have a lot of fiber in it. So a very whole foods diet is probably what we have the most evidence for. Regarding intermittent fasting, fantastic, especially if we have metabolic concerns, but I wouldn't say necessarily for scleroderma. It's also like kind of the be all end all of everything. Mind you, there's always changing evidence, and maybe tomorrow we'll have a bit more evidence too, but I find in scleroderma research, we're often lacking for nutritional interventions. And then also in terms of vitamin D, so I'm not actually fully allowed to discuss dosing. 10,000 is obviously very high. I would make sure that we're not actually toxic. So we always want to be getting our blood work checked. If we're supplementing with vitamin D, if we're in deficiency, sometimes we see supplementation as high as like 10 to 15,000. But generally, like I believe the RDA for supplementation is only like 1,000 to 2,000. It might be 1,000 to 2,500 on the highest range. But yeah, so it's, you know, to give the difference between the low versus the high. So just double checking, you know, getting your levels checked. Usually it should be covered for people with autoimmune diseases because we are at risk of a vitamin D deficiency. So I always say that, you know, bring it up to your doctor if you want to get tested, and say that you've heard that it should be covered. Otherwise, they may make you pay a $40 lab fee, but definitely a really beneficial one to get tested too. And if you're deficient, then those higher doses can be super beneficial for sure.
Excellent. Yes. Just made a note to have that tested again.
Yeah.
Okay. Is there a list of naturopath practitioners who specialize in scleroderma besides yourself?
Yeah, so I don't actually know of any, not even to say. I do know of a couple who are interested in autoimmunity. A lot of people will have like I would say your best bet would be looking for someone who specializes in chronic complex. Is usually what it would fall under. Yeah, I've yet to find someone who's interested in scleroderma, unfortunately.
Yeah, and it's interesting because I did not realize about prescribing, like if like the different qualifications or again licensing, you know, from province to province. So that's interesting as well. So do your homework, I guess, in terms of finding defining a naturopath, and I assume too, like you said too, there are associations in each of the provinces for naturopaths. So learned all kinds of great information here. Okay, Kelly. Can you suggest a gentle magnesium supplement for someone with GI concerns? When I've tried it before, it upsets. Good question, Kelly.
Fair. Yeah, so there is a difference between the different types. So if we kind of want an osmotic pull into the bowel, so in other words, causing diarrhea or not maybe causing diarrhea, but avoiding constipation. And making the stools looser and actually getting someone to have a bowel movement, we're looking at a citrate or an oxide. If we want magnesium for, you know, the other effects, which is usually what we are looking for, we want a bisglycinate or a threonate. Threonate is generally known for brain or cognitive health because it has a higher pass into the blood-brain barrier. But usually, very generally, gentle, you can look for gentle too, but bisglycinate should be completely gentle. Again, this is not a recommendation, but I know that we were even talking about today in my clinic group, NFH, which is, I don't know what it stands for, but it's NFH. Their magnesium bisglycinate is always 100% bisglycinate, because sometimes it's very unfortunate, but you'll look at the ingredients and you'll think you'll be buying a magnesium bisglycinate, and there will sometimes be mixed with like an oxide or a citrate or something that is going to be, you know, aggravating to the GI tract. So yeah, so sometimes it's worth investing in like a one that, you know, is third party tested, and actually taking a peek at the ingredients too, to make sure the one you're taking, you know, isn't, you know, difficult on the GI. I will always say too, even with the bisglycinate, if you're dosing too high, so it could be that the dose might have been a little bit high too, because sometimes that can also just cause diarrhea on its own. Usually the starting dose is around like 200 milligrams, and then you work your way up depending on how you tolerate. Sometimes 150, maybe even lower again if it's that pure form too, then it's kind of doing what it's meant to do. So yeah, that's my biggest suggestion when you're finding that magnesium.
Okay. Thank you. Okay. Well, I don't have any more questions in there. I know someone had also made a comment of just being, you know, very informative and excellent information. So I certainly would echo that, and thank you again, Vanessa, for your presenting in the last 5-6 series now, webinar series.
Yeah.
So it's been great. As I mentioned previously, we're going to be talking about how we can maybe collaborate again moving forward and have a continuing conversation around naturopathic health and scleroderma. So stay tuned, people, and we'll keep people informed what happens. But we don't have any other questions right now. So I'm going to want to thank you for, again, your time, your passion towards this discipline. So I very much appreciate it. And I think I can speak for the community and how grateful we are that you've taken the time to spend with us. And so thank you.
Thanks,
Yes.
guys. And thank you, Michelle. It's been wonderful working with you guys. So I appreciate it so much. Yeah.
Okay. Well, thank you. And you can find our videos on our YouTube channel. And thank you and good night. And we'll see you all again.
See you.